Hello, this is our presentation on the Diabetes and China study. My name is Emily Shannon and this is Deb Super. So we'll start with Campbell's thesis. Prevention or cure of diabetes is possible by eating a plant-based diet and significantly reducing protein intake while completely avoiding animal protein entirely. So, Campbell's key statements is that vegetarian Adventists are healthier than meat eaters, and Adventists depriving themselves of meat also deprive themselves of diabetes.
And he also said, based on World War II England and Wales, that their diabetes went down during their food controls when fiber and grain intakes were up, and later when they started eating more sugar and fats and less fiber, that diabetes went down. And another article, he uses a key statement that type 1 diabetics lowered their medications 40%, and 25 type 2s discontinued their medications altogether. And then next he used a key statement that says 34 out of 40 type 2 diabetics were taken off all diabetic medications. And so we'll look at each of these key statements and the articles that supported them.
So, Campbell starts out with a statement that Adventist vegetarians are much healthier than their meat-eating counterparts. This article was done by an Adventist, Gary E. Frazier, and he is a professor at Loma Linda University, and that is a Seventh-day Adventist university. The study was also approved by the school, and since this study was only done using Seventh-day Adventists, it had such a small window for non-dietary factors would be included, and these non-dietary factors would be like something else that other populations would experience. And the conclusions had very poor indicating words like the findings may suggest, and the vegetarians also consumed animal proteins. So for his second resource, Campbell used the statement that Seventh-day Adventists that deprive themselves of meat also deprive themselves of diabetes. This was done by a non-Adventist, Snowden, and Phillips, who is a professor at Loma Linda University. And like I just said, it is a predominantly Seventh-day Adventist university. This study was based on a hypothesis, and it was done by self-reported questionnaires. So, found it interesting that arterial heart disease was noted as a diabetic death rather than any other. This could be that death certificates are manipulated while the vegetarians also consumed animal proteins, and the conclusions were not very strong. They have those words as in suggest and may.
In Trowell's article covering the food controls, he looked at a 1920 to 1970 snapshot, that the fiber and grain intake was up, fat intakes were down, and later when they started increasing more sugar and fat and less fiber, that diabetes was on the up again. He used vital statistics only, that's all he had. And vital statistics is really just to look back over information they had on food, information they had on deaths, and just general information on people. And these covered all genders and age groups. And in his article, he cited one investigation into deaths that said that the certificates were unreliable and in many cases notoriously inaccurate. And as in Emily's case, many causes of death, such as arterial heart disease, were called a diabetic death. And he also says that insulin was introduced in 1923 and medical care improved, and this was probably a huge reason that diabetes dipped as a cause of death during that time frame. He also talks about how the food intakes were unknown, how the flour fiber contents are unknown, and he doesn't talk about any animal proteins in here, because I'm sure that during food controls, as in before and after, that these people ate what was available to them. So it doesn't support his thesis, of course, and it's an old study. And then with Anderson's article, he said type 1 diabetics lowered their meds by 40% and 25 type 2s discontinued their meds altogether. And the article does bear that out. But the participants were all lean men. This was an article supported by Veterans Administration. It was a completely in-hospital diet, which they say in the article that they would not expect or have anyone eat this sort of diet outside of a hospital environment. And again, it wasn't all plant proteins, so, and it's an old study. And his last key statement was that 34 out of 40 type 2 diabetics discontinued their meds, and the article, Barnard's article, does in fact support this. But what he doesn't talk about is that it's an in-residence program at the Pritikin Longevity Center, and the program is an exercise program, a counseling program, and a diet program with high fiber. And the diet, again, is not strictly plant proteins. And Nathan Pritikin happens to be one of the writers in the article, and he is also the owner of the center and the program. So it's likely to be biased. Again, old study. So for our conclusion, we conclude that the evidence does not support his thesis. No diets consisted of only plant-based proteins, so that alone does not support his thesis. And the food controls article refutes his statements, of his thesis statements anyway, that insulin was introduced in 1923 and medical care improved, and that's probably why diabetes dipped as it did. So, and also the Pritikin Longevity Center article, I think is clearly biased based on what it covered, where it covered, and who was in on the writing, the owner. And it was definitely an in-residence program with other factors included.
So, as you've heard, these studies are extremely old, as in 40 to 15 years old, and Anderson's article is only in a hospital setting, and they only use lean diabetics. And for the Adventist diets, they have no causal data, and it may be biased. And as in the manipulation of the death certificate, it could be because of their extreme religious beliefs. And just a fun fact, I typed in these journals into eigenfactor, and it said there were no results found for my search. Why is that? Maybe they don't approve of these journals, or they could just be that old. Who knows? Thanks for listening. These are our resources, and you have a great day.
Thank you.
Thank you so much.